Question 1. A nurse is teaching a client with type 1 diabetes about insulin administration. Which statement by the client indicates understanding? A. I will inject insulin into the same site every day. B. I should rotate injection sites within the same anatomical area. C. I should massage the injection site after administration. D. I can reuse needles indefinitely. Correct answer, B. Rationale: rotating injection sites within the same anatomical area promotes consistent insulin absorption and helps prevent lipodystrophy. Strategy: remember that proper site rotation improves insulin absorption and reduces tissue damage. Question 2. A client with diabetes reports sweating, shakiness, and hunger. What should the nurse do first? A. Administer insulin. B. Check blood glucose level. C. Encourage exercise.
D. Restricte fluid.
Correct answer, B. Rationale: sweating, shakiness, and hunger are signs of hypoglycemia. Blood glucose should be checked before further intervention. Strategy: assessment comes first when the client's condition is not yet confirmed. Question 3. Which laboratory value indicates good long-term glucose control? A. HbA1c 6.5%. B. HbA1c 10%. C. HbA1c 12%.
D. HbA1c 14%.
Correct answer, A. Rationale: an HbA1c of about 6.5% to 7% generally reflects good blood glucose control over the previous 2 to 3 months. Strategy: lower HbA1c values indicate better long-term glucose management. Question 4. A client is experiencing hypoglycemia. Which food should the nurse provide? A. Grilled chicken. B. Salad. C. 4-ounce fruit juice.
D. Cheese.
Correct answer, C. Rationale: fruit juice contains fast-acting carbohydrates that quickly raise blood glucose levels. Strategy: for hypoglycemia, choose foods or drinks that contain simple sugars. Question 5. Which finding is most concerning in a client with diabetic ketoacidosis, DKA? A. Blood glucose 350 milligrams per deciliter. B. Fruity breath odor. C. Deep, rapid respirations.
D. Dry skin.
Correct answer, C. Rationale: deep, rapid respirations, Kussmaul respirations, indicate severe metabolic acidosis and require immediate attention. Strategy: prioritize airway and breathing problems over other findings. Question 6. Which symptom is commonly associated with hyperglycemia? A. Tremors.
B. Diaphoresis. C. Polyuria.
D. Confusion relieved by juice. Correct answer, C. Rationale: excess glucose causes osmotic diuresis, leading to frequent urination. Strategy: remember the 3 classic signs of hyperglycemia: polyuria, polydipsia, and polyphagia. Question 7. Which insulin has the fastest onset of action? A. Glargine. B. Detamir. C. Lispro.
D. NPH.
Correct answer, C. Rationale: Lispro is a rapid-acting insulin that begins working within approximately 15 minutes. Strategy: rapid-acting insulins are usually administered around mealtime. Question 8. A nurse should monitor for which electrolyte imbalance in DKA? A. Hypercalcemia. B. Hypermagnesemia. C. Potassium abnormalities.
D. Elevated phosphorus.
Correct answer, C. Rationale: potassium levels can change rapidly during DKA and insulin therapy, increasing the risk of cardiac complications. Strategy: always think about potassium when caring for clients receiving insulin. Question 9. Which statement by a client with diabetes requires further teaching? A. I will inspect my feet daily. B. I will walk barefoot at home. C. I will wear properly fitting shoes. D. I will report foot injuries promptly. Correct answer, B. Rationale: walking barefoot increases the risk of injury, infection, and complications related to diabetic neuropathy. Strategy: diabetic clients should always protect their feet and avoid walking barefoot.
Question 10.
Which intervention is most appropriate for a client with a blood glucose level of 55 milligrams per deciliter who is conscious?
Administer Glucagon IM.
B. Give 15 g of rapid-acting carbohydrate. C. Start 4 insulin.
D. Restrict oral attack.
Correct answer, B. Rationale. A conscious client with hypoglycemia should receive 15 g of a fast-acting carbohydrate and have the blood glucose rechecked after 15 minutes. Strategy. Use the 15 to 15 rule for conscious clients experiencing hypoglycemia. Question 11. A nurse is reviewing the health history of a client who has had poorly controlled diabetes mellitus for several years. Which complication should the nurse recognize as a common long-term complication of diabetes? A. Cataracts only. B. Kidney disease. C. Appendicitis.
D. Peptic ulcer.
Correct answer, B. Rationale. Long-term uncontrolled diabetes can damage the kidneys, leading to diabetic nephropathy. Strategy. Focus on complications caused by damage to blood vessels and organs. Question 12. A nurse is assessing a client with diabetes who reports feeling weak and dizzy. Which assessment finding would most strongly suggest hypoglycemia? A. Warm, dry skin. B. Excessive thirst. C. Cool, clammy skin.
D. Fruitibris odor.
Correct answer, C. Rationale. Cool, clammy skin is a common sign of low blood glucose levels. Strategy. Think of the classic signs of hypoglycemia: sweating, shakiness, and clammy skin. Question 13. A client with type 2 diabetes asks the nurse which lunch option would best help maintain stable blood glucose levels. Which meal should the nurse recommend? A. Soda and candy. B. Grilled fish, vegetables, and brown rice. C. Donuts and coffee. D. Cake and ice cream. Correct answer, B. Rationale. This meal provides lean protein, fiber, and complex carbohydrates, which help regulate blood glucose. Strategy. Choose balanced meals with protein, vegetables, and whole grains. Question 14. A nurse is teaching a client with diabetes about managing blood glucose during illness. Which statement by the nurse is most appropriate? A. Stop taking insulin until you feel better. B. Drink only sugary beverages. C. Check your blood glucose more frequently while you are sick. D. Avoid drinking fluids. Correct answer, C. Rationale. Illness can increase blood glucose levels, making more frequent monitoring necessary. Strategy. Remember that sick day management includes continued monitoring and hydration. Question 15. A nurse is educating a newly diagnosed diabetic client about possible long-term complications. Which condition should the nurse include in the teaching? A. Retinopathy. B. Appendicitis. C. Tonsillitis.
D. Asthma.
Correct answer, A. Rationale. Diabetic retinopathy is a common complication caused by damage to blood vessels in the retina. Strategy. Remember the major complications involving the eyes, kidneys, and nerves.
Question 16.
A nurse is reviewing a client's medication list and notes a prescription for insulin glargine. The nurse understands that this medication is classified as which type of insulin? A. Rapid-acting insulin. B. Short-acting insulin. C. Long-acting insulin. D. Intermediate-acting insulin. Correct answer, C. Rationale. Glargine is a long-acting insulin that provides steady blood glucose control throughout the day. Strategy. Associate glargine with basal insulin coverage. Question 17. A client arrives at the emergency department with nausea, vomiting, abdominal pain, and elevated blood glucose levels. Which additional finding would the nurse expect in diabetic ketoacidosis, DKA? A. Bradycardia. B. Fruity breath odor. C. Hypertension.
D. Constipation.
Correct answer, B. Rationale. Fruity breath odor occurs because of ketone production during DKA. Strategy. Look for signs of ketone buildup such as fruity breath and deep, rapid breathing. Question 18. A nurse is providing discharge teaching to a client with diabetes regarding proper foot care. Which instructions should the nurse include? A. Cut toenails very short. B. Trim toenails in a curved pattern. C. Trim toenails straight across. D. Tear off rough edges of toenails. Correct answer, C. Rationale. Trimming toenails straight across helps prevent injury and ingrown toenails. Strategy. Prioritize injury prevention when teaching diabetic foot care. Question 19. Before administering a scheduled dose of insulin, which assessment should the nurse perform first? A. Check the client's hair color. B. Obtain the client's blood glucose level. C. Ask about marital status. D. Review childhood illnesses. Correct answer, B. Rationale. Blood glucose levels determine whether insulin administration is appropriate and safe. Strategy. Always assess the client's current glucose status before administering insulin. Question 20. A nurse is evaluating the effectiveness of a client's diabetes management plan. Which finding best indicates successful long-term glucose control? A. Frequent infections. B. Stable HbA1c levels within target range. C. Blurred vision. D. Recent episode of ketoacidosis. Correct answer, B. Rationale. HbA1c reflects average blood glucose levels over the previous 2 to 3 months. Strategy. Use HbA1c as the primary indicator of long-term glucose control. Question 21. A nurse is caring for a client recently diagnosed with type 2 diabetes mellitus. Which medication is commonly prescribed as a first-line treatment? A. Metformin. B. Penicillin. C. Digoxin.
D. Warfarin.
Correct answer, A. Rationale. Metformin is often the first medication prescribed for type 2 diabetes. Strategy. Know the commonly used medications for diabetes management. Question 22. A nurse finds a diabetic client unconscious in bed. The blood glucose level is 40 milligrams per deciliter. What is the nurse's priority action? A. Give the client orange juice. B. Administer glucagon or 4-dextrose. C. Encourage the client to walk. D. Administer regular insulin. Correct answer, B. Rationale. An unconscious client cannot safely swallow and requires immediate treatment for severe hypoglycemia. Strategy. Never give oral food or fluids to an unconscious client. Question 23. A client with diabetes reports increased thirst and frequent urination over the past several days. Which condition should the nurse suspect? A. Hypoglycemia. B. Hyperglycemia. C. Hypotension.
D. Hypothermia.
Correct answer, B. Rationale. Excessive thirst and frequent urination are classic symptoms of hyperglycemia. Strategy. Remember the 3 Ps: polyuria, polydipsia, and polyphagia. Question 24. A client asks the nurse where insulin is usually absorbed most consistently when given subcutaneously. Which site should the nurse identify? A. Abdomen. B. Buttocks. C. Thigh. D. Upper arm. Correct answer, A. Rationale. The abdomen provides the most consistent insulin absorption. Strategy. When asked about insulin absorption, think abdomen first. Question 25. During discharge teaching, which statement should the nurse include regarding footwear for a client with diabetes? A. Wear tight shoes to prevent slipping. B. Wear open sandals at all times. C. Wear properly fitted shoes that protect the feet. D. Walk barefoot indoors to strengthen the feet. Correct answer, C. Rationale. Properly fitted shoes reduce the risk of injury and infection. Strategy. Protecting the feet is a major goal of diabetic care. Question 26. A nurse reviewing laboratory results notes several findings. Which finding requires immediate intervention? A. Blood glucose level of 52 milligrams per deciliter. B. HbA1c of 7%. C. Stable body weight. D. Improved appetite. Correct answer, A. Rationale. Severe hypoglycemia can quickly become life-threatening if not treated promptly. Strategy. Low blood glucose is an emergency that requires immediate action. Question 27. A client with diabetes suddenly becomes shaky, anxious, and diaphoretic. Which condition should the nurse suspect first? A. Hyperglycemia. B. Dehydration. C. Hypoglycemia.
D. Hypertension.
Correct answer, C. Rationale: shakiness, sweating, and anxiety are common symptoms of hypoglycemia. Strategy: recognize the early warning signs of low blood glucose. Question 28. A nurse is explaining the purpose of HbA1c testing to a diabetic client. Which statement by the nurse is correct? A. This test measures your blood glucose level at this moment. B. This test reflects your average blood glucose over the past 2 to 3 months. C. This test measures kidney function. D. This test determines insulin sensitivity. Correct answer, B. Rationale: HbA1c provides information about long-term glucose control. Strategy: connect HbA1c with the previous 2 to 3 months of blood glucose levels. Question 29. A client asks how insulin should be stored at home. Which response by the nurse is most appropriate? A. Store all insulin in the freezer. B. Keep unopened insulin in the refrigerator. C. Place insulin in direct sunlight. D. Heat insulin before each use. Correct answer, B. Rationale: refrigeration helps maintain the effectiveness of unopened insulin. Strategy: avoid extreme temperatures when storing insulin. Question 30. A nurse is discussing chronic complications of diabetes with a group of clients. Which condition is considered a microvascular complication? A. Stroke. B. Coronary artery disease. C. Diabetic nephropathy.
D. Hypertension.
Correct answer, C. Rationale: diabetic nephropathy results from damage to the small blood vessels of the kidneys. Strategy: remember the 3 major microvascular complications: nephropathy, retinopathy, and neuropathy. Question 31. A nurse is caring for a client with type 1 diabetes mellitus who is scheduled to receive insulin before breakfast. Before administering the insulin, which action is most important? A. Check the client's blood glucose level. B. Measure the client's height. C. Ask about favorite foods. D. Check visual acuity. Correct answer, A. Rationale: blood glucose levels should always be assessed before insulin administration to ensure safe dosing. Strategy: assess blood glucose before giving insulin. Question 32. A client with diabetes reports numbness and tingling in both feet. Which complication should the nurse suspect? A. Diabetic neuropathy. B. Pneumonia. C. Appendicitis.
D. Hepatitis.
Correct answer, A. Rationale: numbness and tingling are common signs of diabetic nerve damage. Strategy: neuropathy affects sensation, especially in the feet. Question 33. A nurse is teaching a client about symptoms of hyperglycemia. Which symptoms should the nurse include? A. Shakiness. B. Frequent urination. C. Sweating.
D. Irritability.
Correct answer, B. Rationale: hyperglycemia commonly causes polyuria due to excess glucose in the blood. Strategy: remember the 3 Ps of hyperglycemia. Question 34. A diabetic client is admitted with blood glucose of 48 milligrams per deciliter and is alert. What should the nurse do first? A. Administer insulin. B. Encourage exercise. C. Provide a fast-acting carbohydrate.
D. Restricte fluid.
Correct answer, C. Rationale: alert clients with hypoglycemia should receive a rapid source of glucose. Strategy: treat hypoglycemia immediately if the client can swallow safely. Question 35. A nurse is teaching a client about diabetic foot care. Which statement indicates a need for further teaching? A. I will inspect my feet daily. B. I will wear comfortable shoes. C. I will wash and dry my feet carefully. D. I will use a heating pad on my feet if they feel cold. Correct answer, D. Rationale: heating pads may cause burns due to decreased sensation. Strategy: avoid anything that can injure insensitive feet. Question 36. A client asks why regular exercise is recommended for diabetes management. What is the nurse's best response? A. Exercise helps lower blood glucose levels. B. Exercise eliminates the need for medication. C. Exercise cures diabetes. D. Exercise prevents all complications. Correct answer. A. Rationale. Physical activity improves insulin sensitivity and glucose utilization. Strategy. Exercise helps control blood sugar, but does not cure diabetes. Question 37. A nurse is caring for a client with diabetic ketoacidosis, DKA. Which prescription should the nurse anticipate?
A. Oral antibiotics.
B. For fluids and insulin therapy. C. High-calorie diet. D. Bed rest only. Correct answer. B. Rationale. DKA treatment focuses on fluid replacement and insulin administration. Strategy. Think fluids first, then insulin. Question 38. A nurse is evaluating a client's understanding of diabetes management. Which statement demonstrates understanding? A. I will skip meals when my blood sugar is high. B. I will stop insulin when I feel well. C. I will monitor my blood glucose as instructed. D. I will double my medication when I eat sweets. Correct answer. C. Rationale. Regular glucose monitoring is essential for diabetes management. Strategy. Consistent monitoring helps prevent complications. Question 39. A diabetic client reports blurred vision. What should the nurse recognize as the most likely cause? A. Blood glucose fluctuations. B. Ear infection. C. Asthma.
D. Appendicity.
Correct answer. A. Rationale. Changes in blood glucose can temporarily affect vision. Strategy. Uncontrolled glucose can affect the eyes. Question 40. A client receiving insulin becomes confused and diaphoretic. What is the nurse's priority action? A. Obtain a urine sample. B. Notify dietary services. C. Encourage sleep. D. Check the blood glucose level. Correct answer. D. Rationale. Confusion and sweating suggest hypoglycemia. Strategy. Suspect hypoglycemia first in insulin-treated clients with sudden neurological changes. Question 41. Which laboratory value is most useful for evaluating long-term diabetic control? A. Hemoglobin level. B. HbA1c level. C. White blood cell count. D. Platelet count. Correct answer. B. Rationale. HbA1c reflects average blood glucose levels over several months. Strategy. HbA1c equals long-term glucose control. Question 42. A nurse is teaching a client about insulin injection sites. Which site provides the most consistent absorption? A. Buttocks. B. Thigh. C. Abdomen. D. Upper back. Correct answer. C. Rationale. The abdomen generally provides the most predictable absorption. Strategy. Abdomen equals most consistent insulin absorption. Question 43. A nurse is caring for a client with a fasting blood glucose of 250 milligrams per deciliter. This finding indicates A. Hyperglycemia. B. Hypoglycemia. C. Normal glucose control. D. Dehydration only. Correct answer. A. Rationale. A fasting glucose of 250 milligrams per deciliter is significantly elevated. Strategy. Know normal versus abnormal glucose ranges. Question 44. A nurse is teaching a diabetic client about preventing foot injuries. Which instruction is appropriate? A. Walk barefoot indoors. B. Soak feet in hot water daily. C. Use sharp objects to remove corns. D. Check inside shoes before wearing them. Correct answer. D. Rationale. Objects inside shoes can cause unnoticed injuries. Strategy. Prevent trauma to the feet. Question 45. A client asks the nurse why kidney function is monitored closely in diabetes. What is the best response? A. Diabetes has no effect on the kidneys. B. High blood glucose can damage kidney blood vessels. C. Diabetes causes kidney stones in all clients. D. Kidney damage occurs only in type 1 diabetes. Correct answer. B. Rationale. Diabetes can damage small blood vessels in the kidneys. Strategy. Remember nephropathy as a major diabetic complication. Question 46. A nurse is caring for a client who develops tremors, hunger, and sweating. Which condition is most likely? A. Hyperglycemia. B. Hypertension. C. Hypoglycemia.
D. Hypercalmia.
Correct answer, C. Rationale. These are classic symptoms of hypoglycemia. Strategy. Recognize early signs of low blood glucose. Question 47. A diabetic client is scheduled for a meal. When should rapid-acting insulin generally be administered? A. Immediately before meals. B. At bedtime only. C. 6 hours before meals. D. After meals are completed. Correct answer. A. Rationale. Rapid-acting insulin works quickly and should coincide with food intake. Strategy. Match rapid insulin with meal timing. Question 48. A nurse is assessing a client with diabetes. Which finding suggests dehydration related to hyperglycemia? A. Bradycardia. B. Moist mucous membranes. C. Weight gain.
D. DRY mucomembrane.
Correct answer. D. Rationale. Hyperglycemia causes fluid loss through excessive urination. Strategy. Look for signs of fluid volume deficit. Question 49. A nurse is teaching a client newly diagnosed with diabetes. Which statement by the client indicates understanding? A. I should never check my blood sugar at home. B. I should follow my prescribed meal plan. C. I can stop medications whenever I feel well. D. I should ignore symptoms of low blood sugar. Correct answer. B. Rationale. Following a meal plan is essential for glucose control. Strategy. Diet, medication, and monitoring work together in diabetes management. Question 50. A nurse is caring for a client with diabetes who asks about the purpose of routine eye examinations. Which response is most appropriate? A. Eye exams help detect diabetic retinopathy early. B. Eye exams are only needed if vision changes occur. C. Diabetes does not affect vision. D. Eye exams are unnecessary with good glucose control. Correct answer. A. Rationale. Regular eye examinations help detect retinal damage before severe vision loss occurs. Strategy. Early detection helps prevent serious diabetic complications.